Good morning, everyone. My name is Rashaad Bhyat. I'm a family physician with a passion for digital health and senior clinician leader working part-time with Canada Health Infoway. It's a very great honor to be joined today by a very dynamic physician leader in the digital health space, award winner, Dr. Payal Agarwal, for a very interesting demonstration of the patient summary in action. But before we get to the demo, let me set the stage with a little bit of context. So Infoway, as many of you in the audience know or may not know, Infoway and its role have been evolving over time to meet the needs of Canadians. So from the early days when we were a strategic investor in the building blocks of provincial and territorial electronic health records towards funding digital tools and change management programs for clinicians, such as EMRs, along with partnerships to strengthen digital health education, towards operating a national electronic prescribing service called Prescribe It, towards pivoting recently to help the provinces and territories fund virtual care initiatives during the pandemic. And now with the pandemic hopefully in the rear view mirror, we have a renewed focus on enhancing national standards-based interoperability to support connected care. And in so doing, we're keeping up the momentum going on at the moment in digital health transformation that's occurring slowly but surely across the country. So Health Canada has provided us with a mandate, has provided Infoway and CIHI with a mandate to work very closely on a shared pan-Canadian interoperability roadmap that is intended to bring the provinces and territories together around key pillars or common goals related to digital health interoperability. The one we are focusing on today, in today's session, is improving provider access. So it's column number 2, improving provider access to patient data at the point of care, particularly aligning Canada around a patient summary standard. The patient summary is what we're here to discuss, of course. The Canadian specification PSCA is aligned with the International Patient Summary, IPS. It's a standard way of representing a patient's key medical information, such as medical problems, history of procedures, medications, allergies, immunizations, and more. And I know some of you were in the session just before us, and Christine very nicely set the stage for this slide here. So this slide shows a visual of how different data domains in the patient summary fit with other data standards. And we may have borrowed this slide, in fact, from our colleagues at CIHI. So I do want to send a huge shout out to our colleagues at CIHI, and thank you very much. So back to the patient summary in practice. Patient summary data is typically collected in primary care settings, but physicians, myself, Dr. Agarwal, we know this information by a different name in our systems and in our training, so there's a translational issue. It is called a cumulative patient profile or a patient history. It goes by other names sometimes. Data collection and data hygiene varies across settings and providers right across the country, and this can really affect how easily data can be exchanged between systems. So we have a challenge. How can we standardize data capture across different EMRs and enable accurate sharing without interrupting clinical workflows or adding significant work? Very specifically, how do we avoid adding to the physician digital administrative burden? We know that clinician stress and burnout existed before the pandemic, but was brought to a crisis point during the pandemic. Now this crisis is evolving, particularly for family physicians and primary care providers, where the digital administrative burden on clinicians is becoming more apparent. And we actually had a whole session on this just earlier that some of you may have attended. It's great. And this has prompted advocacy statements from groups like the CMA, the CFPC, and other clinical organizations in many provinces and territories. And similar patterns have emerged in other parts of the world. So back to our challenge. How can we standardize and enable patient summary data capture and sharing without making this onerous for physicians and other clinicians? In fact, how can we make it useful for physicians, patients, and the healthcare system as a whole? When we think about how we can support clinicians in an increasingly digital world undergoing constant transformation, there are many ways I've outlined in past presentations, but for physicians in particular, change management practice supports are so important, including support for education and training, including CME, changes to undergraduate medical education and postgraduate medical education, investing in change for the long term, and providing change catalysts, and most critically in this case, supporting physicians' use of modern, intuitive, and interoperable tools. And on that note, it brings me great joy to be able to introduce to you Dr. Payal Agarwal, CMIO of Grand River Hospital and St. Mary's, and Innovation Fellow at Weave and Family Physician at Women's College Hospital, who will showcase a very unique innovation that is a modern and intuitive digital tool that may change how we think about data in primary care. Dr. Agarwal.
All right, perfect. Hi, everyone. Thank you so much for having me here. I am so excited to be sharing this innovation with you today. We're really here today, with the leadership of Infoway, bringing together quite quickly a really exciting group of system leaders, vendors, to really help try to show the art of the possible and what could be the power of the patient summary. So, as we know, the patient summary standards have been around for a long time. We've, many of the people in this room have been working through, better leveraging our data standards. But it's really exciting due to, leading edge developments in technology. We really now have an exciting opportunity to leverage the patient summary in healthcare and leverage it in a way that's easy for clinicians, that empowers our patients, and that, helps improve our continuity of care and system as a whole. So today we've brought together a really great group of tools and vendors and leaders from Infoway to show you the art of the possible. So today I'll be sharing a workflow where we've brought together 3 different tools. We're using an interoperable EMR, particularly one from a primary care space. We are bringing together a transcription, ambient listening AI tool, which I'm sure many people are excited about or have experience with. And finally, we're bringing together a really great automated patient summary tool that's powered by AI. So what does it mean to have a patient summary tool? What can that do for us as a health system? So a patient summary tool is a really simple tool that automatically generates a patient summary for the clinician with minimal clicks, right? The key word. And of course, it's integrated within the ER for workflow efficiency, and it does not require any additional sign-on. So this is really the power of technology and where we are today and what we can enable. What's also really exciting, following up on what was just talked about, the patient summary, we can automatically update the cumulative patient profile. So that means we're not only generating, information out from me as a clinician, out into other repositories or other parts of the health system, but the information, the standardized information, actually comes back to me as a clinician in my chart. And we'll talk about it a little bit more, but that becomes really exciting to enable a whole bunch of more efficient, effective workflows in my day-to-day work as a physician. Finally, or also, and of course incredibly important, we've heard so much about patient empowerment and continuity of care. Once we've generated the patient summary, it becomes really easy to share that with patients. There's now a lot of great integrations and more kind of use of consumer health platforms where patients have access to their healthcare right at their fingertips. And once that patient summary is generated, it makes it really easy to share that with the patient. So they're in control of their health information, and they're able to take it with them as they move around our health system. And finally, once we create that standardized data with this tool, it becomes much easier to share it with regional data repositories, provincial health records, enabling sort of single electronic health records, supporting quality improvement, and all those great things that I know so many people in this room have worked day in and day out to enable. Okay, so all that's great, but of course it all comes back to the patient. And what does this mean for a patient and a patient journey? So today I'm going to talk to you about John. John is 61 years old, and he has coronary artery disease and dyslipidemia. He's currently taking 2 medications. He's taking Lipitor and Ramipril, and he quit, luck good for him. He quit smoking 5 years ago. He has a previous 10-pack year smoking history. So, John has a family doctor. He saw the family doctor once, but then moved away to a rural area for work. And, in that time, he hasn't seen his current primary care provider and hasn't had great access to care. So while John was in this rural area 3 months ago, he experienced a heart attack, a myocardial infarction. He was treated in an acute care hospital. He successfully underwent cardiac procedures and was started on some additional medication, including aspirin and metformin. So now John will be coming back to his family doctor. He's returned, and we're going to do a little bit of a demonstration, show the power of the combination of that interoperable EMR, that AI ambient listening scribe, and patient summary AI powered tool. So give me 1 minute to switch to the demo. Okay. All right. Okay, so today we have John. John, if you could please join me. There we go. Perfect. All right, John, thank you so much for being here today. I'm really glad. We haven't seen each other in a while, so I'm really glad that you came to see me.
Hi, Dr. Agarwal. Yes, I don't know if you remember, but I did move away a while ago, but I moved back recently to be closer to good doctors like yourself, and also to keep an eye on my health situations. It's been a bit of a tough year for me.
Okay, well, I'm really glad you're here then. Before we get started, are you okay? I'm going to be using an AI tool called Ambient Listening. It's going to listen to us, write my notes. That way I get to focus on you instead of the computer.
That sounds great.
Okay, perfect. So let's get that up and running. Okay, amazing. So can you, John, can you tell me a little bit about why you're here today and what's happened recently?
Sure. Like I said, it's been a tough year. I had a heart attack about 3 months ago while I was away. I went into our local small hospital. They transferred me to the general to have that procedure, you know, the one in which they unblock the arteries in your heart?
Oh yeah, a cardiac catheterization.
Yes. And they also said that I have high blood pressure and type 2 diabetes. I couldn't believe it on top of everything else.
Oh wow, okay. Well, I'm really glad you're here to follow up on that. Do you know in hospital, did anything else happen? Did they start any new medications?
Yes, the hospital doctors gave me a couple of new medications. I am taking them every day. I'm still taking Lipitor and Ramipril. One's aspirin, I think. I have them here written on paper. Hang on one second.
Okay, paper, perfect, thank you. Okay, I see that. You're on aspirin and metformin. Okay, great, thank you. Okay, how are you feeling now recently? Have you had any chest pain, shortness of breath, anything like that?
No, I'm feeling good. I'm not having any chest pain. I'm not short of breath. I'm not dizzy or anything like that.
Okay, good to hear. So I know you saw our nurse just before you saw me, and sounds like your blood pressure was 120 over 80, and your heart rate was 80, which is great. So I think now, I'm very glad you came back to see me. As next steps, we'll be ordering some blood work. We can follow up on your diabetes. I'll be referring you to diabetes education, so you're able to better manage your diabetes, and then you can come see me in 1 month.
Sounds like a good plan. Thanks, doctor.
Okay, great. And just to let you know, we have a new tool here. So soon you should be able to, I know you earlier logged in to our portal, but you'll be able to get access to your information on the phone.
That is excellent. Thank you so much.
Thank you. Thank you for coming in, John. All right. Okay, so now what we're able to do, which is amazing, don't have to sit there and write a note. I just can come in here, and there's my note. And so now we've got John, the note's written, but of course, the information's with John is only in my note. It's not, mobilized in any other way. It's just in a text document. So now what I get to do with this lovely innovation is generate in a very quick, easy way the patient summary. There we go. So you can see here, with pretty much one click, we've generated a patient summary. This is all standardized data, standardized to the format, as outlined by the patient PS-CA. We're able to go in, a clinician, if they want, can sort of accept, edit, work on different things. But the reality is, most of the time, what are you going to do? You're going to come over here and click Accept All. And that's it. It now becomes part of my patient record. So I close this. I will just refresh the screen, and there you go. It's part, you can see here, it's really great. So over in the disease registry, we now have standardized data in our EMR. That means that now my EMR can be more intelligent than it was yesterday. I can start to do proactive care. It can start helping me fill out forms. You can see here the medications are updated, less risk of things like transcription errors and medication errors. So really, quite quickly, we've, created high quality data that empowers me as the clinician. And finally, last but not least, the most important part is our patients. So we've generated that information. How do we get it to our patients? Because of course, that's the most important place it needs to be. So again, due to, really exciting advancements in both sort of our consumer health technology as well as integrations that are happening within our Canadian ecosystem. Oh, sorry, it's already up here. Yeah, so, go into my health app, and you can see here, as a patient, I now, at my fingertips, have access to the patient summary. So you can see allergies, conditions, medical records, all there at the fingertips for a patient. Okay, so let's get started again. Perfect. So you've heard what happened with John. John came, he saw his family doctor. I got empowered with great information, and he got empowered with great information at his phone. Unfortunately, though, after seeing me a couple of weeks later, John was at a restaurant, and he started to experience severe chest pain and some altered level of status in his cognition. So, of course, they called 911, and he was taken to the nearest hospital via ambulance. When his care team in the ambulance and in the ER staff was asking him about his past medical history, of course, he couldn't communicate. He couldn't remember what was going on. But luckily, his wife was able to step in. She pulled out John's phone and was able to pull his patient summary up right on his cell phone, share his medical history with the ER staff. So right there immediately, we were able to provide John much better, much safer care. So just as a recap, we were hopefully able to kind of get you thinking about the art of the possible and what we can do with the patient summary and all the advances that are happening in technology. So really the patient summary is a really core tool to empower a lot of really important things in our healthcare system. So first, we can leverage technology and the investments in technology that allow clinicians to really quickly and easily generate the data required for the patient summary. And we all know that's critical, right? Making it easy and quick. Second, of course, we've heard so much about the importance of care continuity and supporting our patients, and the patient summary, once generated, really enables us to easily share the most important information about a patient across our health system, and to ensure that patients are empowered and know what is going on with their health and have that access to that when they need it, anytime. And finally, the piece that for me as a clinician definitely hits home. Once you create that standardized data and put it back into the patient chart, it can actually really help support improved workflows and efficiencies that reduce administrative burden. One example, many in this room are working on e-referrals, which is amazing, and centralized wait lists. But as we develop those pathways, so much of it will require us to know, okay, does the patient have diabetes? Yes or no? Does the patient have comorbid hypertension? Yes or no? And me filling out that as a clinician, not an ideal workflow. But once we've got standardized data and the patient summary generated, all of that can become a lot more easier and reduce that burden of e-referrals and centralized wait lists. So just one example of the power of the patient summary.